All right, we have some entry-level remote healthcare jobs. One of them is part-time, one does not require related experience, and the rest just want a little bit of office or support experience. Nothing too heavy. Let's get into them. So the first one I have comes to us from Isaac Health. This job is for an intake specialist. It's full-time remote anywhere within the United States, no location restrictions. And they tell us they're seeking a detail-oriented, tech-savvy, and personable intake coordinator to join the team. In this role, you'll be the first point of contact for many of their patients, ensuring a smooth and welcoming experience. You'll be responsible for confirming appointments, organizing patient information, and troubleshooting telehealth visit issues. So that pretty much sums up what you're going to do on a regular basis in this position. You need strong organizational and time management skills. You have excellent communication and interpersonal abilities. You're comfortable using digital platforms, and you have basic troubleshooting skills. You're comfortable using Zoom, EMRs, and online forms. They prefer, but they don't require. They prefer you have experience in a healthcare or telehealth environment. You can multitask. You have no problem working in a remote setting. You have a high school diploma or equivalent, and it's a plus you have a degree, and that's just a plus. It's not required. So I'm going to scroll back up to the top of the job description because they show us the salary. Right here they tell us they'll pay you $40,000 to $45,000 per year. So our next position is with Evolent Health. This job is for an intake utilization management coordinator. It's full-time remote anywhere within the United States, no location restrictions. And in this job, you'll serve as a point of contact for processing prior authorization requests in accordance with departmental policies, regulatory requirements, and client contractual agreements. So what that means is you'll check to see if submitted requests require a prior authorization review or redirect as required, do a whole bunch of data entry into the proprietary system, work with physicians' offices to obtain missing information required to submit a prior authorization request, and you do that via fax, email, or through the provider portal. You'll submit IT tickets to address barriers to generating cases for clinical review and following the ticket through to completion. And you do that while meeting established utilization management intake objectives and key results. And for this job, they want you to have a high school diploma or a GED and 1 to 3 years experience in a coordinator role, either requesting or submitting prior authorization requests and or relevant healthcare experience in claims or appeal and grievances. You're comfortable using computers, you can meet deadlines, and then you need all your typical soft skills. And for the salary, scrolling down the bottom of this job description, they tell us they'll pay you $20 per hour. Okay, so next up we have a coordinator manufacturer special programs with the company Walgreens. This job is full-time remote anywhere within the United States. I did not see any location restrictions anywhere on this job description. And what you do is provide service to new and existing manufacturers, hubs, and patients with any issues related to their prescriptions, clinical services, and program inquiries. Basically, you'll process referrals from initial approval through verification and shipment in compliance with contractual requirements. You'll serve as a single point of contact for manufacturers and third-party hubs related to any patient prescription, program, or data query, while ensuring policies and procedures are followed. You'll coordinate patient care by scheduling referrals, communicating shipment information, assessing supply needs, verifying patient information, and triaging patients to a pharmacist as appropriate. You also create and process all assigned referral and order stages, including reorders received by electronic data feed, fax, mail, and phone. And you may even do some data entry, call doctor's offices for prescription clarifications, and update patient medical profiles. You'll perform review of patient financial documents, create and distribute daily bridge report and quick start reports for review of patient eligibility, complete monthly benefit investigation to determine patients' eligibility for patient assistant programs, inform pharmacists of any changes to a patient's condition, compliance issue, or side effects, and transfer patients directly to a pharmacist for counseling as needed, and assist patients with a variety of activities, which might include follow-up calls regarding orders and refills, initiating the discharge of patient from services, and contacting a patient's doctor's office to schedule delivery of an order. So for this job, you need a high school diploma or a GED and at least 1 year experience in patient care, healthcare, retail, or customer service-oriented role. You have experience providing customer service, you're an excellent communicator, you're able to prioritize and manage multiple responsibilities, and you have experience developing ways of accomplishing goals with little or no supervision. And they list some preferred qualifications. Whenever I see preferred, that tells me they're just preferred, not required. Read through these preferences. If you meet any of them, make sure to include them on your resume. And we can see on this job description, they tell us they'll pay you $16.50 up to $22 per hour. Accenture Health has an opening for a review assistant. This is full-time remote anywhere within the United States. And it looks like they want you to be available to work between the hours of 8:45 a.m. and 8:15 p.m. Eastern Time Monday through Friday, as well as 9:45 a.m. to 7:15 p.m. Eastern Time on weekends and holidays. And you don't have to live in the Eastern Time Zone. Just translate your local hours to those hours, and your schedule will be somewhere within those hours. In this job, you'll provide primary non-clinical program support by encompassing provider training, customer service, call training, authorization prep, data entry, and the development and tracking of functions for members and providers. You'll also review patient records for completeness, process and document case discharges, ensure accurate and prompt submission of all administrative-related documents to relative parties, act as a liaison with internal and external customers, and you'll do all that while upholding medical records confidentiality through proper use of computer passwords and secured files, adhering to HIPAA policies. And it looks like they will provide some training in this position. So to qualify for this job, they want you to have a high school diploma or a GED and 1 to 2 years experience in administrative or records management and 2 to 3 years in an administrative support or customer service position, and you're familiar with healthcare. And they have a whole bunch of preferred qualifications. Again, whenever I see preferred, that tells me they're just preferred, not required. But as I read through them, it looks like most of them are your typical soft skills, but read through them. If you meet any of them, make sure to include them on your resume. And as far as the salary, I'm just scrolling around to see if they tell us how much they pay. Yep, way down here at the very bottom, they tell us they'll pay you $17.46 up to $17.75 per hour. And this is a typo. They have year, but it is per hour. So our last entry-level healthcare job is a part-time position. It comes to us from Axiom Medical. This is for a part-time intake case coordinator. It is part-time, it is remote anywhere within the United States. I did not see any location restrictions. And what you do is assign new cases to medical staff in accordance with corresponding licensing laws. You'll provide excellent customer service in a fast-paced environment, perform administrative duties to multiple departments as needed, develop and maintain corporate and professional relationships with fellow employees, supervisors, and leadership from various departments, and perform initial assessments of intake calls. So for this job, they'd like you to have a combination of demonstrated experience and education that is equivalent to 1 year experience with a focus on call center, customer service, or related fields. Now, I said this is a part-time position. As we take a look at the application on the right-hand side of your screen, they tell us you'll work up to 30 hours per week with shifts potentially beginning as early as 11 a.m. Central Time and lasting through 5 p.m. Central Time. And schedules are based on the needs of the business. And as far as the salary, they don't tell us how much they'll pay anywhere on this job description, but based on my experience looking at similar roles, I think this kind of job could pay anywhere from $15 to $18 per hour, but there's no way I can guarantee that's how much you'll make. You'll have to work out your salary with them. So that's all I have for you in this video. Hopefully one of these entry-level healthcare jobs works out for you. And if you're looking for more opportunities, check out this video right here. Thank you so much for visiting. I truly appreciate your support, and I'll meet you on the next job lead.